This is Alex McDevitt with the RHSC, and I just want to welcome everyone to our webinar this morning. We're thrilled to be putting on this webinar to highlight the progress being made on Combipacks in our community. We will be hearing from our colleagues at WHO and Concept Foundation. And just one point on logistics, all of the attendees will be muted automatically. You will be able to type in your questions in the question box, and you can type those in throughout the presentation. We will have a brief moment for questions after we hear from WHO, and then at the end we will open it up for more of a question and discussion section. And during that time, you'll be able to hit the raise my hand option, and that we will be able to unmute you, and you can verbalize your questions if you prefer that to typing them in. And now I'm going to turn it over to my colleagues Jennifer Blum and Natalie Kapp to get us started.
Good morning, everybody, and thank you for participating in this. I believe it might be our second or third webinar for the Safe Abortion stream at NERT, so delighted to have you all here, especially in the middle of summer. I'm just going to quickly, as Alex mentioned, we're going to be hearing from both WHO and Concept Foundation today, and we're going to start with a presentation from Kartik representing WHO. So let me give his brief bio. Kartik is a public health physician with experience in sexual and reproductive health programming and a specific interest in safe abortion and contraception. He is also a consultant with the WHO Safe Abortion team and has led efforts organizing the technical consultation that I believe many of us participated in on Combipacks at the WHO in collaboration with Sida in January of 2018. He also has a broad experience in safe abortion programming across Africa and Asia, including work on registration of medical abortion commodities, introduction of medical abortion services, and quality of care for SRH services. Lastly, he also consults with IPPF and has been a technical lead in the development of a global medical abortion database, which we're all very much looking forward to the launch of, that will be listing medical abortion products from over 75 countries. So on behalf of Natalie and Alex and myself, I again welcome everyone to this webinar and look forward to these presentations and an exciting discussion. So Kartik, I'm going to hand it over to you.
Thank you, Jennifer. Can everyone hear me okay?
You sound great, Kartik.
I can hear you, yeah.
Thanks. Thank you to Alex, Jennifer, and Natalie for giving us the opportunity to actually share some of the work from the WHO team around expanding access to quality-assured, co-packaged mifepristone and misoprostol, which we're going to refer to as Combipacks for the rest of this presentation. So I have a very short presentation here just to give an overview of what's happened so far, and then also what's currently underway in terms of the efforts in coordination and collaboration to increase access. As Jennifer pointed out, many of you might be aware of and have probably participated in the technical consultation that was organized by WHO and Sida in January, which was aimed at actually looking at what is currently happening and how can we work together to increase access to quality medical abortion services through increased access to the Combipack. And the consultation was over 2 days and focused on quality assurance of the product, pricing, and the different procurement supply chain issues related to ensuring access to the drug. The consultation was an excellent opportunity to kind of understand from the different stakeholders. So we had a range of stakeholders, including manufacturers, donors, Ministry of Health representatives, research organizations working on safe abortion, social marketing organizations, and nonprofit organizations working to expand access to services. And it was a good opportunity to get a very diverse perspective in terms of what is currently happening in the field and the efforts that are going into increase access to medical abortion. Using that as a starting point, we were able to identify some of the critical gaps and develop an action framework in terms of what needs to be done to move the field forward in increasing equitable access to quality assured Combipacks. The consultation was basically an attempt to improve coordination and collaboration amongst the different stakeholders, bring them together, and see how we can maximize the results with the efforts that's currently going on. So following the consultation in January, we had the action plan, and WHO has been reaching out to a wide range of stakeholders. Most of you are on the call today in terms of talking and seeing the interest and seeing how we can align the current work that is being done by the different organizations and coordinating that in a manner that can lead to greater results focused on the principles of quality, equity, and access. And that's what's kind of led to this global Combipack initiative, which is a set of activities that WHO has put together in coordination and collaboration with a range of partners to increase access and take forward the agenda from the consultation. So to start with, I wanted to just give a brief overview. Many of you might be familiar with this, but it's always good to kind of get it in perspective. One of the things that we see is misoprostol is obviously more widely available and registered across the world than mifepristone is. Mifepristone, as of early 2018, is registered in approximately 67 countries, and there are a range of countries, additional countries, where currently efforts are ongoing to register mifepristone, either as a standalone or as a Combipack. And misoprostol's availability is much greater, but it's also important to note that currently misoprostol is usually registered for an obstetric or non-obstetric indications, and there's very limited registration specific to an abortion indication in many of these countries. And especially for induced abortion, there isn't, I might be wrong on this, but I don't think there's any country where there's misoprostol that's exclusively registered for an induced abortion indication. So drawing on that, Combipacks, which is just the co-packaged 2 drugs in the same blister, is registered in a much smaller subset of countries where the mifepristone is registered. And if you look at the global picture in terms of what is the status of quality assurance for these medical abortion drugs, and I'm sure Concept is going to have a slide and they're going to talk a little bit more about what we mean by quality assurance in this, so I'm not going to cover that now. But if you look at the 3 broad aspects that we're looking at in terms of WHO pre-qualification status, or a current UNFPA ERP approval, or an stringent regulatory authority approval, you could see from the table there that we have very little products, Combipacks especially, that are pre-qualified or UNFPA approved or SRA approved. One thing I wanted to highlight in this is mifepristone. There are 3 products that are currently WHO PQ'd, and there is 1 additional product that's SRA approved. For misoprostol standalone, there are 3 products that are WHO pre-qualified, none that have a current ERP approval from UNFPA, and 9 additional brands or products that are approved by an SRA. And within this, it's important to note that apart from 1 product, 1 SRA approved misoprostol, which is widely available in many countries, many of the other products of misoprostol that are SRA approved tend to be either available only in the US, in Canada, or within Europe. So in terms of access to a quality assured misoprostol, that's not really happening as widely. And similarly for Combipacks, there are only 2 brands of Combipacks that are currently SRA approved. One of them is available only in Australia and Canada, and the other is available in a few low and middle income countries. So you can really see that in terms of quality, there really needs to be a greater emphasis in making more products available so that the table looks a lot more populated with numbers rather than many of the nuns. So drawing on this and all the other issues that we had identified in the consultation, WHO's put together this global Combipack initiative focusing on 4 themes. And what I'm going to do in the next few minutes is broadly give some of the key activities that we are trying to achieve and trying to work on under these 4 broad themes. The first one, as you can see, is directly linked to the previous slide highlighting the lack of quality assured products. So the first theme is efforts to increase global availability of quality assured Combipacks. And within that, the 2 broad areas of activities that WHO's focusing on is 1, is to increase awareness and resources that are actually available around the quality assurance of medical abortion medicines, especially misoprostol. So as many of you in the room are aware of, there's a wide range of knowledge and awareness around what are the issues in relation to the quality of medical abortion commodities, and also what can be done, what should be done in terms of both from a manufacturing perspective, but also how the product has to be stored and maintained and used within the supply chain. So one of the key lessons learned and learnings that we had from the consultation was we need to really get more evidence-based resources, highlighting what are the critical issues, and increase awareness and knowledge amongst the stakeholders about the issue of quality assurance for medical abortion commodities. The second thing that we are focusing on is, in simple terms, to increase the global pipeline pipeline of quality assured medical abortion medicines available. Now, you'll notice that I'm actually using Combipacks and medical abortion medicines interchangeably. The focus of the initiative is on the Combipack, but we believe that working on the issue of Combipacks, we will also see benefits for quality assurance for misoprostol and mifepristone, the independent components that make up the Combipack as well. So what WHO has done so far since the January meeting is the expression of interest from WHO for pre-qualification of medicines now includes a specific category for Combipacks, the co-packaged mifepristone misoprostol. And we've also been able to work with UNFPA along with Concept Foundation and others to include within their expression of interest for the ERP process a specific category for Combipack. So this creates an opportunity for manufacturers, for interested parties to actually engage with the quality assurance process, specifically focusing on Combipacks in addition to mifepristone and misoprostol as well. The second theme that we are focusing on, in addition to increasing the pipeline, is to better understand the pricing of quality assured medicines and how we can use that information to improve affordability and equity of access for women across the world. Under this, there are two broad areas that WHO is focusing on, and there's another supplementary activity that I'll be talking later that will also feed into this. So the first one is working from a manufacturing perspective. WHO is working with Concept Foundation to undertake an analysis of cost of goods manufactured exercise. Now, this exercise, which Concept will probably talk a little bit more about, will give us an understanding of the pricing from the perspective of a manufacturer. Supplementing this information, we also feel that WHO feels that it'll be useful to commission a retail price analysis for Combipacks and medical abortion medicines across countries. So this is something that we are still working to identify a partner and hopefully define in much greater detail. But basically, the aim of this activity is to identify what are the issues in procuring medical abortion drugs by women at point of use. So whether it's in a hospital pharmacy or self-use, what are the challenges that women face? What are the issues to consider that affect pricing for women of these medical abortion commodities? So these are two broad areas that we're working on as well. The third theme that supplements and builds on what the other themes does is to increase commodity security for quality assured Combipacks. And within that, we're looking at a broad range of activities, including identifying a good product, procurement, distribution chains, supply chain systems, and all of that. Under this, I wanted to highlight two broad areas, which I think would be really, really important for the entire community to kind of use as a starting point. So one is doing these assessments, both a global assessment and a regional or a local assessment. So CHA is already currently underway. The Clinton Health Access Initiative is currently already undertaking the global assessments to understand the market for medical abortion commodities. And within this, they're specifically looking at quality assured medical abortion commodities. So they're looking at what different models and what learnings they can bring from the area of other reproductive health commodities into medical abortion commodities. And hopefully we'll have updates from CHA in the next couple of months, which should then give us a much better and more nuanced understanding of the issue of commodities for medical abortion. Now, drilling that down a little bit better to understand what are the issues in different regions, WHO is also in the process of identifying partners who would be willing to undertake more focused assessments. These could be regional assessments, for example, the Western Francophone Africa regional assessment, or assessments that are specific to countries where there's a lot of investment and strong health systems that are offering services. This is an area that we are still defining the scope of work and the deliverables and looking for partners. So if any of you who are listening to this conversation know someone who's interested, or you yourself are interested, it'd be fantastic if we could continue the conversation offline after this. Supplementing these two big assessments that looks at the big picture of what's happening for the commodity landscape, WHO is also working with a subset of partners to identify what models of procurement and distribution could lead to a more sustainable supply at the national level. And within this, we are looking at three different models: one that engages the public sector, one that engages the not-for-profit sector, and the third that could either be a global supply chain, a global distributor like UNFPA, or a private sector model that works on a different dynamics and different levers, basically. So within this, we are looking to see if UNFPA could revise the price of the Combipack that is currently available on the catalog, and then using that as a starting point, would it be possible for UNFPA to coordinate efforts in doing a pooled procurement or doing a regional supply based on pooling the procurement requirements for small markets. In addition, we're also looking at working with other nonprofit organizations to see how small markets, which is one of the challenges that we identified at the consultation, would still be a viable market from a business perspective and will allow for manufacturer engagement to supply those markets in a sustainable manner without price being driven very high. So these are some of the efforts that WHO is focusing on and just starting out in terms of expanding access and ensuring commodity security. And the last theme is, once we hope that we have a global pipeline of quality assured products available, we have evidence to work on the pricing issue, and we understand what are the principles or the nuts and bolts of an effective supply chain. We want to actually then translate that into increased access to these medicines for women on the ground. And within this, there are two specific strategies that WHO would really like to work on in partnership with Concept Foundation and the other partners. The first one is basically to leverage the WHO collaborative registration process. Hans will probably speak a little bit more in detail about this, but just to give you an overview, this is a voluntary process that allows for the WHO pre-qualifications team to share confidential information with a national regulatory agency in exchange for an accelerated registration process. So this is an opportunity to ensure that a quality assured product, a pre-qualified product, can gain registration and access to country markets through the collaborative process. This would be a big win. It's not been tried very often for medical abortion commodities, so this is going to be a pilot exercise for all of us. We hope to learn where the challenges are and what the advantages are, and hopefully we'll have results in the next 12 to 18 months on this. And once we are able to get those registration and regulatory access to different markets and countries, we also want to look at how a country introduction plan for quality assured combipacks should be undertaken. So that's going to look at a more holistic approach of converting access to the commodity into a quality service for women. And that will include a range of activities from advocacy, looking at market authorizations, in-country distribution, the local distribution, looking at training of healthcare providers and all other allied partners within the health system to see how we can actually position the product, ensure access to the product in a safe and quality manner. And most importantly, we hope to we are aiming to kind of document the lessons from the 4 country introduction plans that we are aiming in the next 18 months to see what are the key things that stakeholders should take into account when they're actually looking at a country introduction for medical abortion, either the new introduction or introducing it at scale. So basically, to summarize, the vision for the initiative is, while we believe that there's going to be a strong focus on quality assurance of combipacks, and the focus is going to be on the co-packaged product, we anticipate that benefits will be for a much broader base of all medical abortion medicines and commodities. And WHO is actively seeking partnerships in this effort. The success of this initiative depends purely on the ability of the different stakeholders and the different organizations to be willing to collaborate with us, to share their lessons learned, their expertise, the current work that they're doing, but also undertake implementation of some of the activities. And that's where, as I mentioned before, there are a few activities where we would really appreciate if anyone who's interested in the webinar reach out to us to actually see if they would want to define the scope, agree on deliverables, and then take that forward. And one of the other principles that's guiding WHO in this is the aim of WHO within this initiative is to facilitate collaboration where there are opportunities, improve the coordination so that we are timing the different activities that current stakeholders are already planning so that we can achieve maximum access to a quality assured service. So just moving forward, my last slide. As I've highlighted before, once the medical abortion database from IPPF is released, you will also have a better sense of the availability of the different individual components versus the combipacks in themselves. And from there, it will be really critical to understand that there is an increased need for availability of quality assured combipacks, even in countries where mifepristone is registered. And as I mentioned before, WHO is still looking at specific areas where they would really like to strengthen further partnerships. And these are one in doing the in facilitating manufacturer engagement to go through the quality assurance process. That's a constant area that we're working on in seeing how we can make sure that the quality assurance process works for manufacturers and they are excited and continue to be engaged in that process. We're also looking for partners who would be willing to undertake regional or focused country assessments. And I know there are a lot of organizations that currently have large country programs. So any collaboration or data sharing or resource sharing from that would be really, really helpful. The retail price analysis is again a very critical component. So once we understand the big picture in terms of from a manufacturing perspective, from the global assessment that Chai is doing, the opportunities, we need to really marry that information with what's actually happening on the ground within a socio-legal context of how abortion services and access to abortion commodities work for us to actually undertake an intervention that would have an impact for women. And the last thing, we are also looking at identifying appropriate models for procurement and supply for very small demand markets. So any market that has a need, annual need for medical abortion commodities less than 25,000 units is considered a small market from many businesses, and they are not seen as lucrative or as cost effective from a business and manufacturing point of view. So we're trying to identify what models and what supply chain initiatives would be effective for them in the long term in a sustainable manner. And last, to supplement all of this, we continue to work closely with all the partners in terms of undertaking advocacy to improve global and national policy environment, looking at mainstreaming the inclusion of medical abortion commodities into national and global essential medicines list, looking at licensing requirements, prescribing requirements, and improving information around the availability of medical abortion commodities. Any questions? Thank you.
Thank you, Kartik, for that very comprehensive presentation. It sounds like the WHO has a lot on their agenda in this area, so it'll be exciting to see how that work all moves forward. In the interest of time, if there aren't any clarifying questions, I think we shall move on to the next presentation. I don't see anything coming up on the chat, so I'm going to hand it over to you, Natalie, to introduce our next presenter. Thank you again, Kartik. That was very interesting.
Thank you.
Yes, so as the screen is coming up, this is Natalie Kapp, and I'm the other co-chair for the Safe Abortion Supplies Workstream. And I'm going to introduce our colleagues from Concept. So Melanie Larson is currently managing projects under the Access to Maternal Health and Safe Abortion programs at Concept Foundation. Her past roles include conducting research for a public health institute in Spain and supporting projects at the Global Alliance for Improved Nutrition in Geneva. She has training in public health from George Washington University. Hans Vermeer was trained as an obstetrician gynecologist and reproductive endocrinologist and had a business education at INSEAD with experience in Europe, the USA, and lower resourced countries. He has worked in academia, in R&D and management in the pharmaceutical industry and at Jhpiego before joining Concept Foundation. He's presently the CEO of Concept Foundation in Geneva and Bangkok. And with that, we'll hand it over to Melody and Hans.
This is Hans Vemer. Hi, thank you, Natalie. Thank you, Jennifer, and all the others for your introductions. I'm glad to be here and to be able to explain a little bit about what Concept Foundation, together with the World Health Organization, is doing to make sure that women have access to quality assured, safe, and affordable medical abortion products. Can I have the next slide, Melanie? Thank you. Concept Foundation, one slide about Concept Foundation. We have been working on making sure that women's lives and futures are better, especially in low and middle income countries, by working on generic sexual and reproductive health medicines. We do that in the fields of maternal health, in the fields of family planning, and in the fields of medical abortion, where we try to combine or want to combine high quality and low cost. How do we do that? Basically by working with generic manufacturers in low and middle income countries who are willing to produce their products up to the quality standards that either a stringent regulatory authority or a WHO pre-qualification team is asking for. So we help them with manufacturing and quality certification if necessary. We help them with registration, and if necessary, if they want to, we help them with market introduction, advocacy of their products in the different low and middle income countries. And in that way, try to make sure that there are not only products available and that are affordable, but also that there are high quality, low cost products available. Can I have the next slide, please? Thank you. Kartik mentioned several times quality as a keystone of what we are doing. And that is also what we focus on. At Concept Foundation, we think that quality should come first. And I'm saying that because we have seen that many procurers and donors tend to focus on price, and only if the price is right, then start looking at quality. And usually take the lowest price available and then look at quality. We think that you should look at quality first. You should look at quality products. And if you have a good quality assured product, then you start looking for the lowest price of those quality assured products. So quality should come first. Quality is actually not expensive. Quality is actually costing less. It is much cheaper to give a product of 15 cents that actually works and that keeps women out of the hospital, that keeps women alive, that keeps families together, than to have to administer 3 products of 10 cents because one pill doesn't work, and you have to, because of the low quality, you have to give 3 pills to get the effect of 1. So we try to also convince ministries of finance and ministries of economic affairs in countries, and not just ministries of health, that it is often far better to procure a quality assured product than to buy just the cheapest product available. Quality assurance is something else than quality control. Quality control is a system that you use at the end of the production, where you check if the quality, the moment it leaves the factory or the moment it enters the country, is a good product. That is quality control. Quality assurance means that you focus on quality during the whole process of research, development, manufacturing, production, packaging, distribution, shipping, etc., etc. Kartik mentioned a few times the quality of misoprostol, which is very often not what it should be, and that is in few cases the case because the product is not produced at a good quality, but very often the product is produced at a decent quality, but then is packaged wrongly. Now, misoprostol is very humidity sensitive. So if it's not packaged in a double aluminum foil, then you know that the quality deteriorates very quickly. So that is, if you do quality control, the moment the product leaves the factory, then you see a good product. But if you have quality assurance, you make sure that it's packaged packaged well, and that also after 2 or 3 months in a pharmacy, the product is still up to a good quality. Quality assurance is an investment. It is not a cost, it is an investment in the lives of women, an investment in a good product as well. And what do we mean with quality assurance? As we discussed also at the January meeting that Kartik was talking about, we think a quality assured product means the product is either approved by a stringent regulatory authority, or is WHO pre-qualified, or is recommended by the expert review panel for recommendation 1 or 2, so it can be safely used. And only in cases that there is no product available, which is either SRA approved or pre-qualified or ERP recommended, can you look for another kind of quality control measurement. But since there are, especially in the field of safe abortion drugs, pretty soon, and now already, but pretty soon even more quality assured products available, I think this should be as a lead, a first instance, a pretty good definition. I want to say one word about SRA approved, because Kartik mentioned the collaborative registration procedure of the World Health Organization. That is a very important procedure where the WHO gives a kind of a general registration recommendation of a product. WHO pre-qualified products can easily apply for this collaborative registration procedure, where if the WHO gives that CRP recommendation, it means that the company can go to the ministries of health of tens of countries, specifically low and middle income countries, and say, look, the WHO looked at our file, the product is WHO pre-qualified, so can you please give us a quick recommendation? And we see in other fields that is happening very quickly, that within a few months, products can be registered in a large number of countries with this procedure. So that's why we want to emphasize the importance of it. Now, as I said, it is being used already in a lot of other products. Now it has to be used for the either mifepristone or misoprostol, or even better, the combipacks as well. Can we have the next slide, please? Thank you. And this is what Consent Foundation has been doing in the Safe Abortion Program with the Combipack. And I like to hand over now to our program officer, Melanie Larson, who will take you through the next slides. Melanie?
Okay, great. Thanks, Hans. So I'll share a bit of background, and I'm hoping that it won't be too repetitive from what Kartik has already shared. But Consent Foundation, we provided preparatory work to WHO that was in support of the January technical consultation, which Kartik highlighted. And many who are joining the webinar were in participation or participating in that meeting. But just to mention again that the consultation brought together key stakeholders who are working in the space of medical abortion to really help identify gaps and to develop a framework for further collaboration among partners to improve availability of quality assured combipacks. So as an outcome of the consultation, there were a number of activities that were identified that were related, again, to quality, related to pricing, and to support expanding procurement of safe medical abortion combipacks and medicines. So really to sustain this momentum that was generated from the meeting, Consent Foundation, with support and in close collaboration with WHO, are undertaking a package of initiatives to help drive this work forwards. So I'll just briefly highlight some of the projects that we're currently engaged in that are aimed at increasing access to quality assured medical abortion commodities at the global and country levels, and some of the tools and resources that are being developed to support a broader framework for quality assurance across the supply chain. So under this theme of increasing supply and access to quality assured combipacks, Consent Foundation, we're providing technical support to a manufacturer towards earning WHO pre-qualification. So as Kartik mentioned earlier, there are only a couple of quality assured combipacks that are SRA approved, and they have really limited availability in low resource settings. So this would be the first WHO pre-qualified combipack that would be available on the market, and registration of the product would be targeted for low and middle income countries. We're also engaging with other manufacturers of combipacks to identify if there are other potential opportunities for collaboration. So that could be whether that's working with manufacturers also towards WHO pre-qualification, or even ERP recommendation. And then also just to highlight that following the meeting in January, Concept helped to facilitate engagement between UNFPA and a combipack manufacturer, and that helped to assist in its inclusion in the UNFPA catalog and a revised price for that quality assured product. And this is important to mention because UNFPA during the January meeting had indicated that they had actually not received any orders for combipacks in recent years. We are pleased to already share with you that the inclusion of this quality assured Combipack at this new revised price is already attracting interest in procurement through this global mechanism. Alex, it seems that okay, it's working now. Froze up there for a moment. So now I'll share some of the work that we're doing at the country level. So again, concept in collaboration with WHO and a manufacturer and country level stakeholders are working towards the introduction of a quality assured Combipack in Kyrgyzstan. So we're currently in kind of the initial planning phases of this project, but the introduction will be, of course, evidence-based, and it's going to be taking on a broader system strengthening approach. So this means, for example, it will include obviously increased access to a new technology. So by providing access to this quality assured product, also identifying optimal procurement and distribution channels for the Combipack. It's also going to include a policy component to support an enabling environment to really ensure that midwives and nurses will be able to provide medical abortion. And this builds on the evidence that's been generated by WHO. And then other components, for example, will also include capacity building to ensure that healthcare personnel will be adequately trained and equipped to provide these medical abortion services. So turning now to some of the tools and resources that Concept is developing. So we're working as Karthik highlighted, that we're working on a cost of goods model for medical abortion commodities. And so as we all know, there are multiple costs and fees that are incurred across the supply chain prior to reaching the end user. And so what this model will be able to provide is insight on the cost of a manufactured product that can help to inform costs upstream to support broader pricing initiatives and discussions to improve access to quality assured medical abortion products. So Concept, with generous support and with inputs from USAID Global Health Supply Chain PSM project, we've developed a quality assurance manual for procurement and supply of maternal, newborn, and child health commodities. So this has been designed for procurement agents and low and middle income countries to really ensure quality assurance in procurement and supply. It contains guidance that's aligned with international standards with WHO, MQOS, as well as it provides a pragmatic approach to assuring quality in limited resource settings to really ensure its relevance and use. The manual also contains technical information, and this can be used to help establish specifications for priority life-saving commodities. So we anticipate that this manual will be disseminated by USAID Global Health Supply Chain PSM project in the coming months. That should be available. And Concept, with the support of WHO, is developing additional resources around quality assurance for medical abortion commodities. So again, these are intended to be useful tools for the sexual reproductive health community, as well as program planners who are planning to procure medical abortion commodities. So we're developing a series of technical reviews for mifepristone, misoprostol, the Combipack, and these will include information on best practices that are aligned with international standards, as well as special considerations for ensuring quality across the supply chain. And again, these reviews, we anticipate they should be available late this year or early next year. So with that, I will leave that for any questions and hand it over to Jennifer and Natalie. Thank you.
Thank you so much, Melanie and Hans. That was excellent to hear, and it's great to hear that there's been so much activity since our meeting in January. So we'll take questions now, and you can, I think, raise your hand, or you can also type it in the chat box. And I'm going to start with one that has already been sent in to us. And this question is for Karthik. Presumably getting the Combipack on national EMLs is a key step to increasing availability, particularly in the public sector. However, there doesn't currently seem to be a clear recommendation from WHO for countries to do so, either in clinical guidelines, which don't mention the Combipack, or in the WHO model EML, which includes meso and MIFI, but no mention of the Combipack. Are there strategies included in this project to address this, to encourage government actors to support the Combipack formulation? So Kartik, you'll have to unmute yourself.
Yes, I just realized that as I was talking to a muted microphone. Thanks for the question. Thanks, Natalie. Yes, so this is one of the issues that we've definitely identified as part of the larger issue around how we can support or ensure a change in the policy and regulatory environment that can support sustainable and equitable access to quality assured products. So one of the things that WHO is currently in discussion with the Access to Medicines team is to look at what opportunities exist for including the Combipack within the WHO model list of essential medicines. And as most of you know, that the model list of essential medicines are revised every 2 years. So there is a window of opportunity for us to actually work together as a community and see how we can move forward on that. So WHO has definitely identified this as an priority activity to ensure that Combipacks get reflected in the WHO essential list of essential medicines. And I think once that's come through, then it's possible for us to use that as a reference point and support the advocacy of in-country partners and stakeholders to go for it. So short answer is yes, it's been identified and there are currently discussions ongoing. And we'll have to see how it happens because it's also an evidence-based public consultative process. So work is underway.
And can you remind us when is the next, it happens every 2 years, so when is the next time that the revision is happening?
So the next revision is actually happening next year, and applications for the change have opened up as of 1st of June, and they're due by 5th of December. So that's the window of opportunity for us to make applications for any changes to the list. So we have time up until early December to actually make the application. And then there'll be a open, it'll be put up for public viewing, and then there'll be a consultation in April next year, following which the list of model medicines would be updated.
Super, thank you. We have another question. This one is for Melanie or Hans. Currently, there's a monopoly of quality assured meso and MIFI APIs. Only one of each WHO is pre-qualified. Is there any work ongoing to support expanding the number of quality assured API sources?
Shall I answer that? The answer
yes.
is yes. The answer is yes. The mifepristone is a difficult to make and very expensive API. So there is one quality API procurer. We are at this moment working with a second one who probably will have a pre-qualified API very soon, definitely this year. Regarding misoprostol, we're also working with at the moment 2 API manufacturers to see if they can get to pre-qualification. So yes, there's work going on. There's no guarantee yet, but it's an extremely good remark, and it's one of the bottlenecks that we are facing, because if the one API manufacturer, one reason or another, stops working, fire in the factory or whatever, then we are in real trouble. So yes, we are seeing the need for more API manufacturers and trying to address it. Any suggestions are welcome, but we're trying to address it.
Terrific, thank you. Here's another question that just came through, and I think that this is potentially for either Concept or WHO. Given that many women are likely using low quality medical abortion products, is there any evidence of the impact of this, And do we know anything about the poor outcomes of using low-quality misoprostol, for example?
Hans, do you want to go first, or?
Yeah, that's okay, Kartik. I'll give you a little bit of time to think about.
Okay. So I have a few examples that I can share, but unless you want to go first.
Yeah, well, it's great that there are a few examples. What we know anecdotally is specifically from work from the Guttmacher Institute, that especially when women think that they have procured a good quality misoprostol product, they take that product, buy that product with their last dollars, take that product, and if it doesn't work, then they have to rely on unsafe abortion. So and that leads again to maternal mortality and morbidity. So the problem is, as the people who work in this field know, and as Kartik definitely knows, that the statistics and the data on unsafe abortion are very difficult to come by. People don't want to talk about it. Governments say it doesn't happen in our country, etc., etc. But Kartik, if you have examples, please go ahead if you have more data.
Sure. I think this is a very important question, because that's one of the things that I think there's a lot of paucity of data, and there's very differential understanding between the stakeholders as well, in terms of what happens if a low quality product is used, how does it actually affect clinical outcomes and a patient experience. And I think it's important to recognize that when we're talking about a quality product versus a quality service, there are multiple components, including one of which is a good quality product, that make up a good quality service. So, for example, service delivery organizations have models of how they assess quality of medical abortion services. So they look at provider knowledge, they look at the regimens that are being used, they look at routes of administration, they look at the doses that have been used. They also look at recording practices to see when are they looking, because medical abortion is a process, you need to make sure that you've given enough time for the process to act completely before you actually follow up with a woman, and then you could assess if a woman is experiencing any side effects or unintended effects from a poor quality product. So there are different components that make up this issue. So we cannot simply say that using a low quality product will always lead to this. It most likely will, but we just don't have the data to make an evidence-based claim necessarily, because there's so many other components. The second thing that I also want to highlight is it's important to note that currently what's happening is women use a lot of products for which we don't have information on quality. That does not mean that all of these products are necessarily a low quality product. And I think it's important for us to also differentiate and understand that nuance, because we don't want to now suddenly say miso is a bad drug, it can't withstand humidity, therefore we shouldn't really be looking at it, or we should really be looking at a very expensive miso only. So that's the other issue that we're trying to do with the consultation and the initiative, is to bring general awareness around the issues that are there with the stability of misoprostol, and the need for us to have a lot more transparency and information available on the product that is being used in different programs, so that we can assess independently whether the product is of good quality standard or not. Yeah. There are examples, and complicating all of this is also the issue of falsified products. So that's another big issue. There have been instances where one of the SRA approved, most widely available product has been counterfeited. So women in extremely restrictive settings who use the black market or the gray market to actually access these medicines are the ones who are most affected. So we've identified women who've used, who have procured misoprostol in Indonesia, in Philippines, from really restrictive settings, which has turned out to not to contain even a single microgram of misoprostol. So those are some of the issues that actually complicate. So there's no simple and straightforward answer to say what are the statistics for women who use poor quality products. Having said all of this, I'm sure a lot of these service providing organizations that have robust follow-up mechanisms for women that they serve would be able to give data around the outcomes of medical abortion. So for example, putting on my other hat and drawing from the experience of work in IPPF, we had identified in Pakistan, for example, that one of the big challenges was we saw a complication rate of about 25% for ongoing pregnancies, excessive bleeding, retained products of conception. And once we didn't drill down and we identified products in testing, we did find that 2 of the products that were being used were actually failing to meet the specifications. So that's one example of how we identified a clear link after ruling out the different variables, that the issue of poor clinical outcomes was actually linked to the product. So that's one anecdotal example that I can say. Although it's one-off, there is evidence to support the claim that we've made in that. So long-winded answer, apologies for that, but there you go.
No, I think that's an excellent response. Can I ask a question about the counterfeit medicines? Was that identified in the IPPF programming?
No, it was actually identified from a pharmacy. So we ran a harm reduction approach in one of those countries, and that harm reduction approach included not distributing the direct medicines from the program itself, and women were asked to source the medicines independently. And to ensure that they received a good quality medicine, we undertook testing of that medicine. So that is what turned out to be counterfeit, not one that was used within the clinic.
Okay. I have another question, which is misoprostol is recommended to be administered sublingually, buccally, or vaginally for medical abortion. However, the innovator/comparator product is stated for oral use only. Is this a stumbling block for affordable, quality-assured product development, considering formulation issues, bioequivalent studies requirements, or anything else? This is probably more a question for concept. Hans or Melanie?
Yeah, I can give an answer, and if Melanie has an addition, she can chime in. It is true that the innovator doesn't want his product to be used, or at least registered for, officially used for medical abortion, and that's why they never went for the vaginal route indication. It is a little bit of a well, I don't call it a stumble block. It's a little bit of a hindrance that companies that want to go for pre-qualification of the misoprostol have to do a relatively small bioequivalent study against oral, and that is, yeah, that's being done. We supported some of these studies. It's not extremely difficult. It's not extremely lengthy and extremely expensive. So it is done, and the pre-qualified products and the pre-qualified combipacks, the products that are in line to become pre-qualified, but specifically the pre-qualified misoprostol products for safe abortion, have the vaginal administration, vaginal route. Melanie, you want to add something or not?
I think that was quite comprehensive. Thanks, Hans.
Okay, thank you. Does that answer the question, Natalie?
Yes, I believe so. Thank you. One other question for concept. Your quality assurance manual, is that going to be available to the general public, to everyone, or how are you going to disseminate that?
Melanie?
Yeah, that's a good question. So that is being led by USAID, the PSM project. So I think their initial plans would be to disseminate to their country programs, but I also understand, I think it will be available to the wider RHSC community because as part of the maternal health caucus, it's part of the work plan. But as for timing, I can't provide any specifics, but it's nearing completion. So we're anticipating that it should be available in the coming months.
I think that would be of interest to Reproductive Health Supplies Coalition. So if you can possibly disseminate it, that would be, I think, useful to people.
Yeah, so it's kind of left with PSM at the moment, but I do understand that they are planning for a wider dissemination.
Okay. Well, I want to thank everyone for, it doesn't look like we have any unanswered questions, so I want to thank everyone for their participation in our call today, in our webinar. And I want to remind you that we plan on having quarterly webinars, so I think we'll have another one in the fall, maybe September or October, and our plan at this moment is to hear about the launch of the IPPF database, which Kartik talked about briefly in his talk today. So that will be, I think, of great interest to all of us. Jen, do you have anything to say? Or
No,
Alex?
just thanks everyone for their active participation. And if anyone has any ideas for things they want to add or would like to present alongside the IPPF database in the next webinar, we'd love to hear from them. So please send us ideas.
Yeah, and if not this fall, we'll have another one during the winter. So there's plenty of time for you to propose a webinar to update us on your work.
Great, and this is Alex with the RHSC, and I'd just like to reiterate thank you to everyone for joining this morning, this afternoon, whatever time it may be for you. I will be sending around a recording of this webinar, and also there's requests for Hans, Melanie, and Kartik's contact information, so I will send that around as well with that recording. And as Jennifer and Natalie said, we look forward to everyone joining in our next webinars in the future. So thank you.
Thank you, everyone, for the opportunity to present the work as well. Thanks.
Great.
Thank you.
Thank you all for your support. Thank you. Bye.
Thanks.